1 in 5 Indian children is overweight or obese. The latest ICMR India study also tells us that we are eating a lot more carbohydrates. Kids are sleeping late, eating late. Nighttime binging is the worst habit that one can have for pre-diabetes or insulin resistance. We need to increase the protein content in our diet, but at the same time, reduce the carbohydrate content and replace some of the carbohydrates with protein-rich foods. There are multiple advantages of having protein at every meal, what we call protein pacing. You will feel fuller, eat less, your caloric intake is maintained, and you're preventing blood sugar spikes after every meal. Plant protein-rich foods also come with fiber. It is very easy to take in a lot of calories, but it is so very difficult to burn those calories. 60 to 70% of the effort is your food. If you can make changes there, then the exercise will only benefit.
Hello, I'd like to welcome all of you to this podcast. Today we'll cover the subject, the role of protein and fiber in diabetes. We know how rampant diabetes has become. And fortunately, today we have Neeti Desai with us to tell us about this subject. I'd like to welcome Neeti on this podcast.
Thank you very much. Always a pleasure.
Neeti has done her master's in nutrition from India and the UK. She's been a prolific writer for 18 years for various newspapers and journals. Also, she's been nutritionist to many glamorous people, industrialists, and I think what I'm touched about most is our Olympians like Gagan Narang and Mary Kom. She is also the vice president of the Association of the Diabetic Educators and the co-editor of the IDA Dietetics Manual. That's the latest edition. Now, there's a little personal aspect to this that I'd like to tell you about. Neeti is my personal dietitian. 8 years back, I had the standard issues which all of us have, high sugars, high cholesterol, and I was sent to her by my doctor. A little hack she gave me. She said, protein increase it a little, carb reduce it a little, be careful about the quality of carbs, and touch wood. And by her great advice, my numbers are better today than they were 8 years back. So I am living proof of the fact that diets work and more of us need to benefit from this. This little insight is really the founding thought at Prolicious, and we aim to get the protein up in daily foods. Thanks so much and welcome. A shocking statistic. 10% of the kids between the age of 1 and 19 are pre-diabetic. That is a terribly disturbing number. Clearly something has gone wrong. Tell us what exactly has gone wrong.
Yes, of course, it's multifactorial. There are multiple reasons, the origin of which lies in our lifestyle and primarily overnutrition, which leads to obesity. That is the beginning of the problem. So childhood obesity is unfortunately, the numbers are again staggering. 1 in 5 of Indian children is overweight or obese. Now, this is because, of course, what we are eating matters. We are just eating a lot of carbohydrates. Data tells us, the latest ICMR India study also tells us that we are eating a lot more carbohydrates. Whether we go north or south, east or west of the country, it's the same problem. Also, when we eat also matters. Kids are sleeping late, eating late. Nighttime binging is something that is the worst habit that one can have for pre-diabetes or for insulin resistance. The easy availability of highly ultra-processed foods, which are extremely high in low quality of carbohydrates, they are low in protein and high in saturated fat. That availability is also an issue because now this is available at the click of a button, even at 1 a.m. in the morning. So that is not helping. And then, of course, the screen time. Children are more sedentary. They are either hooked to the iPad or the phone or to the game box. So that is again, the physical activity is low, the caloric intake is more, the expenditure is low. And of course, even your sleep routine matters. So kids, if you sleep late, you wake up late, you are completely messing up your metabolism. So as I said, it's a multifactorial problem, but it's basically lifestyle related.
Yes, I know Netflix is really a time when it makes everything so very hard. So now from a health standpoint, 30 seems to be the new 50. In the old days, it was at 50 that you started hearing of health problems, and now it's at 30. So when does one start caring about diabetes? And what really is the problem with diabetes? I mean, what are the negative impacts on the body?
So, as we just discussed, the problem is not even at now 30, maybe it is from childhood that we need to be careful. And in fact, for the next generation, we need to be worried even for the in utero. When a woman is pregnant, she needs to start caring and worrying about the child, because what a mother eats uh, has a reflection in the child developing chronic diseases in adult life. In fact, an obese or overweight mother has twice the chance that her child will be overweight or obese. So, its prevention is the key. As early as we can start, that is what we should be looking at. And well, when we talk about diabetes, we all know that it is kind of it's a silent disease, right? Even if your blood sugars are high, on the face of it you may not get the symptoms, you may be fine, and a lot of people say, why are you making such a big deal out of it? The problem is that when there is a lot of sugar in your blood circulating throughout your body over a period of time, it affects different organs. So they are called either macrovascular complications, where basically it affects your heart, it affects your brain in terms of stroke, or they are also called microvascular complications, where it affects your kidney, it may affect your feet. So this disease is something that is long term, it is not going to go away, and it will only escalate if we don't take care of diabetes.
I'm glad you've told us about the thing because most of us know sugars, but we don't know the impact of sugars that really comes to us. Yeah. We, I came across the INDIAP study, which stated that if you up your protein content to 20%, you have a chance of diabetes remission and obviously avoiding it. What, in your personal experience, is this ideal macronutrient ratio, specifically with regards to protein?
This is so very true, and we see it all the time in practice. As you mentioned, you have a personal experience with that. I have seen that even if we bring the ratio up to say 15%, anywhere between 15 and 20%, it works. We are at the moment maybe managing between 8 to 12%. There needs to be this little tweak where we need to increase the protein content in our diet, but at the same time, more importantly, reduce the carbohydrate content. It's not just about adding protein to what you're eating at the moment. We need to reduce the carbohydrates and replace some of the carbohydrates with protein rich foods.
I think this is really so very important. Most of us tend to take protein extra, but actually cutting the carb is probably as important as increasing the protein.
Yes, and it's not rocket science. Uh, if you are having, for example, three rotis and a little katori of dal, which could be just this much, and this is what we generally see, you just need to replace this with a larger katori of dal, and automatically your roti consumption will go down to two. So it is about crowding the diet with more protein rich foods, which will automatically crowd out the carbs.
I think I'm so glad you sort of pointed it out with such a practical example. Now, Viti, there is also the a lot of discussion around fiber these days. If you could just tell us about the health benefits of fiber for general health and in specific for diabetes and sugar management.
Yes, fiber is a very, very important nutrient and has multiple health benefits. So, if we talk generally, of course, fiber helps with the digestive health. It prevents constipation. It improves your gut microbiota. The good bacteria numbers can go up with increased fiber intake. Also, soluble fiber, one type of fiber helps reduce cholesterol, and there is enough data which tells us that a high fiber diet reduces the incidence of diabetes and heart disease. Also, high fiber diet is linked with longevity, and foods which are high in fiber are also packed with a lot of other nutrients like antioxidants and phytonutrients. So, if you increase your fiber, you are basically overall increasing the quality of your diet. When we talk about diabetes in particular, most importantly, fiber prevents blood sugar spikes. So it absolutely helps with your blood sugar regulation. If you include fiber at every meal, you will not get those highs. So that's a very, very important and easy tool to adapt. And of course, fiber also helps improve satiety. It makes you feel full. So you tend to eat less. And weight loss, of course, is one of the most important goal when we talk about type 2 diabetes. We lose weight, 5% weight loss, and still we get amazing results in our diabetes. So fiber, again, a very, very important tool for diabetes as well.
Great to know that protein and fiber are both so important for the management of diabetes. I'd like to understand a little. The ICMR guidelines suggest that there is a risk to having whey protein supplements. If you could tell us what is the risk and how do we eat more natural and more healthy?
Right. So the recent guidelines tell us, and ICMR is very, very keen that we increase our protein intake through whole foods, through our diet, by including protein rich foods. Because there is some evidence that is emerging that whey protein perhaps increases insulin resistance. And that is exactly what we don't want in our Indian population, where we have these staggering numbers of prediabetes and, of course, diabetes. Also, there are multiple advantages of having protein at every meal, what we call protein pacing. Because at every meal, you will feel fuller, you will eat less, so your caloric intake is maintained, and you're preventing blood sugar spikes after every meal. So there are again multiple benefits. Protein rich foods, especially plant protein rich foods, also come with fiber. So again, you're getting a double bonus. So we would be preferring to have whole protein foods rather than continuing to eat what we eat and then guzzling down a scoop of protein. That is what a lot of people, I see that in practice, that people continue to eat what they are eating and they think they are doing their bit by guzzling down one or two scoops of protein. Unfortunately, that doesn't work as well as including whole protein foods at every meal.
I think we have lots to learn over there. In the whole day, I think the evening snack is probably the toughest, where one seems to have the least amount of protein rich or healthy options to eat. Could you tell us how one should manage that part of the day?
Yeah, you're absolutely right. In fact, that's the time when everybody is hungry. It's that 5 o'clock, 6 o'clock time. But a lot of people don't know what to have. A lot of patients or clients ask me that. And then for many, it's what is available, right? So there is then a quick vada pav or a samosa or a plate of chaat, and that's what happens. Now, this is the time when we need to actually plan our snack, because snacking is going to happen. So, some very simple options would be having our humble chana or gram, what we call. You could do a sprout salad, you could do a pot of yogurt, and for even something like cut salad sticks with a hunkered dip or with, say, hummus, that works. For those who really like their namkeen at that time, which is what very often is the challenge, we have now a lot of options where instead of doing the potato chips or the banana chips, you have the lentil chips, the dal chips, which are available. Similarly, you have protein rich khakras, or you have even the roasted chana jor or roasted moong jor, which are not particularly fried, or even the most favorite bhujia is there, which is now not fried, but it is protein rich. So one needs to plan that 5 o'clock snack. Do not wait till you are very hungry, because then nobody can be sensible. we need to preempt the hunger. So if you think you're always famished at 6 o'clock, please have your snack at 5:30, because then we are able to control the portions also.
I think that is a very, very helpful little tip. Eat before you're really famished.
And it works, and it works. Yeah, because it's very difficult to be sensible by anyone once one is very hungry.
And we have so many myths around protein. एक तरफ से everyone tells us protein intake बढ़ाओ. On the other side, many feel that if I have too much, what's going to happen to my kidneys? Makhana, is it high protein? Millets. So if you could just tell us a little about the typical myths that you encounter and educate all of us on what is the really right way forward.
Yes, so I think that's another challenge. And in fact, there is again enough Indian data which tells us that in fact 93% of the population that was surveyed did not know what their protein requirements are. So the problem starts from there. And then there was a lot of 85% thought that green leafy vegetables are a good source of protein, which clearly it is not. Vegetables are not a source of protein. Others think that it's not protein that is important, it is a multivitamin supplement that I need to take and I'll be good. I'm doing my bit for health. So again, that is not correct. And then there's a lot of fear about protein also. Oh, if I increase my protein, will my kidneys get affected? Isn't too much protein bad for health? So these are the most common questions that come to me in at the clinic. And we need to understand that we as Indians are primarily a vegetarian nation. Even the ones who call themselves non-vegetarians may have non-veg once or twice in a week. It's not like there is non-vegetarian food at every meal. So when you are on a vegetarian diet, it is very, very difficult and unlikely that you're going to exceed your protein requirements. We are not, in fact, meeting our basic requirements. So don't be worried that you're going to take extra protein from whole foods. So that should not be a worry. You should always try to include protein rich foods at every meal. So which primarily will mean for a vegetarian diet would be any of the dairy products, which could be a skim milk, yogurt or paneer made from skim milk, or all the pulses and dals, and of course soybean. When it comes to non-vegetarians, of course, you have a choice of eggs and the lean meat, which is primarily fish or chicken. The red meat consumption, again, has to be brought down.
And makhana is considered high protein. Could you tell us a little about that?
Yes, it is. Makhana has achieved a cult status. It is considered a superfood. It is not high in protein as it is made out to be. The pulses and dals are much higher in protein content. Makhana has perhaps a little more protein than our wheat and rice, but it also has a lot of carbohydrates. So if you want to have makhana, it's great to have makhana, but add some chana to it or add some protein to it, add some sprouts to it. But then it becomes a good snack. Makhana on its own will still be a lot of carbohydrates.
And could you tell us about millets?
Yes, so millets are a very important kind of nutri-cereals, and they have been popularized in the country. And it's a great grain to have because it's a very hardy grain, does not require a lot of work from the side of the farmers also. However, because of its popularity, the millets have, of course, the market has been flooded with millets. We need to make sure that what we are buying is unrefined, unpolished millets, because most of the millets which are being sold are now highly polished and therefore refined, and therefore they behave almost the same way as white rice would or atta would. They will give you a sugar spike. Also, because millets are better than wheat and rice for sure, that does not mean it's a free food. The portion control still matters. We still need to control or measure the amount of millets that we are eating, because after all, it's still carbs, a little more of protein, lot of fiber, but portion control is a must, and choosing the right brand where it is unrefined, unpolished, extremely important.
Thanks for the clarification on those myths because that's really important for us to understand what's right. And now, when it's just so easy to take medications, is diet at all important? I mean, to manage diabetes?
Well, I think this is a very common question. However, for diabetes, medication, diet, and physical activity or exercise, these are the three pillars of the treatment. And one is not mutually exclusive to the other. So, if I'm taking medication, so I don't need to bother about diet and exercise, unfortunately, it does not work. Medication is in fact tailored to what you eat, right? And if you don't take care of that, then the medication dosage will only have to be increased to manage the blood sugar levels. And if that doesn't work, then the next step is going on insulin. So it is, in that sense, it is not a very forgiving condition. We need to take care of all the three pillars. And if we take care of the two pillars, the diet and exercise, then the pharmacotherapy or the medication dosage can be reduced. In fact, this works at any stage of diabetes. We've had people who've been on insulin for years, and with the change in the diet primarily and physical activity, they've been off insulin. People who are on medication have been able to reduce the dose or go off the medication depending on the stage of their condition. And people who are pre-diabetic or who are just beginning to are able to ward off the medication completely and go back to a normal lifestyle. So diet and exercise are not a choice. They are absolutely important. Just like they're important for healthy lifestyle, they are even more important for the treatment of diabetes.
And a little clarity on the relative role of exercise and diet in the treatment of sugar.
Both are important pillars, but the reality of life is that you cannot outrun your calories, right? It is very easy to take in lot of calories, but it is so very difficult to burn those calories. So diet, unfortunately or fortunately, takes a more important role. So 60 to 70% of the effort is your food. If you can make changes there, then the exercise will only benefit. When we are talking about diabetes in particular, there are a certain pointers there. One is that if you're starting off with exercising for the first time, it is very important that you check your blood sugar levels just before you start your exercise, and during and even after, at least when you're starting off a new exercise program and you know where they are. So that is very important. And also, if you can't exercise too much, even if you walk for 10 to 15 minutes after every meal, that itself also helps to bring down blood sugar levels. Of course, there are guidelines. The guidelines tell us that people with diabetes should be exercising 150 minutes in a week, uh, with one or two sessions of weight training or resistance training included. So this is the requirement. Depending on the patient's age, mobility, if the person is very obese, all this may not work. So as I said, even walking after meals, short periods, will help to bring down blood sugar levels. Exercise needs to be highly personalized. It's not one size fits all.
Interesting to note that. And a little about animal proteins versus plant proteins in the management.
Yes, so proteins work basically. Each has its pluses and minuses. Again, in our Indian scenario, because we are primarily vegetarian, for most lot of people, animal protein is not a choice. Animal protein is, of course, good protein, first class protein, but it generally comes with also lot of saturated fat, right? So therefore, red meat is to be discouraged. Lean cuts of meat can work. Plant protein is something that is going to be more applicable in our Indian scenario. And here the big advantage is that along with the protein, we also get the fiber and lot of other nutrients which are associated with the whole foods. So that's a very big bonus. The only caveat here, which I think I would like to highlight, is that plant protein also comes with some carbs. Our dals, our pulses, uh, of course, have protein, but they also have carbs. So we will need to adjust that. We need to cut down the frank carbs, the roti, the rice, and add the plant protein or add the pulse and dal. I think this is something that we need to really it needs to be highlighted, and we really need to make sure we do that.
Thanks for that. And now, the big issue about the CGM and what we see on social media and the kind of people who tell us that, you eat this, your sugar goes up, I ate this, it came down, etc., etc. I understand that diabetes is serious. Could you tell us the risks associated with this, and how does one look at this CGM thing?
So I will take this as in two parts. CGM is a great tool to kind of be able to monitor your blood sugar levels. It prevents you from pricking, which a lot of people are averse to. But then there is also, we need to be careful about a few things. One is that there's a lot of information overload, and we've seen that very often then people start disregarding it, and there's like a decision paralysis. So that's one. The other very important point to make is that foods such as cakes or cookies or pastries will perhaps not give you that sugar spike. And because you are monitoring on CGM, you can see it in real life situation, and then you are like, wow, oh, I'm good, I can eat this. But that is not correct. If a food is also very high in fat, it prevents the blood sugar spike, but that doesn't mean it is healthy, because the fat, and especially saturated fat, is something that we do not want to include in our diet beyond the required amounts. So do not go completely by the CGM numbers. Please visit your doctor, your nutritionist, refer to the professional for reading the CGM charts also. uh, and secondly, I think that's a very important point you made. Uh, Somebody who has lost 7 kilos is now beginning to give advice, give gyan to us on nutrition. Somebody who has interest in nutrition has done weekend courses and is talking about nutrition. They call themselves lifestyle coaches. Now the latest one is a metabolic coach. So till this field is unfortunately regulated, which the government is working on it, the Allied Health Council has been formed. Please be wary of the lot of noise that is happening on social media. And in fact, even when you visit someone, try and make sure that you check their credentials and qualifications, and go to a qualified nutritionist or a dietitian.
This is just so very important, Niti, because I think I agree with you. CGM is a phenomenal tool, but we need to understand its risks. And more importantly, we need to understand whom we are taking the advice from. I mean, that is just so very essential. We've learned a lot. Now, on the practicality, the little hacks, tell us a little about how we should eat. What are the little things that we should be careful about?
Right. So, to make everything kind of simple, if I can show you a plate, basically half of your plate needs to be filled with vegetables and fruits. And again, the ICMR guidelines tell us that we need around 400 grams of vegetables and 100 grams of fruit, and it shouldn't be the other way. Also, 1/4 of your plate should be filled with protein-rich foods, and little less than more than 1/4 should be just carbohydrate rich foods. What is happening at the moment is, in fact, 3/4 our plate is filled with carbohydrates, and that is what we need to work on. So next time you serve yourself, make sure that half your plate is filled with your vegetables and salad, and then there is 1/4 of protein rich foods, which includes your pulses, dals for the non-vegetarians, the other choices, and only 1/4 is your roti or rice, which again you need to perhaps move to uh, using other grains such as jawar, bajra, even our humble amaranth or rajgira, we call it, instead of just our regular milled wheat. And white rice could be replaced with brown rice, red rice, with the different millets that we talked about. That would be great. And there is also the suggestion is that we need to include dairy, especially skim milk product, whether it's milk, yogurt, paneer in our diet. And this makes a complete meal plan. So it's not rocket science. You just need to keep this in mind next time you serve yourself.
I think this concept of fruit and salad and vegetable is something most of us need to imbibe because I think that that is one ratio, and of course the carb ratio which we need to improve. So I mean, we've learned so much. If you were to kind of just wrap the whole conversation today and make it a bullet point takeaway for us, what would that be, Niti?
Yes, as I said, look at your plate next time. Half the plate needs to be vegetables and salad with and one-fourth protein, one-fourth carbohydrates, but the carbohydrates need to be coming from grains which have high fiber. So the bottom line is increase the protein intake, reduce the carb intake, and the kind of carbohydrates that you choose need to be high fiber, whole wheat, less refined grains.
Thanks so much. It's really been a great learning for all of us. I've benefited. I'm sure the rest of us who are watching this will also benefit tremendously. Thanks, Nidhi. Thank you so much for this.
Thank you so much.